What I find very odd is that there are so many foundational principles that we understand about child development that have been discarded as gender identity theory encroaches on our understanding of children. So sex constancy is a theory that is part of developmental psychology. Around age 7 and 8 is when this starts to become a concrete concept. So a 5-year-old will believe that if you are female and you put on, a boy's uniform at school, then you become a boy. And by the time a child is about 8 or 9, they start to understand, no, that's just a girl wearing a boy's uniform, and vice versa. But to introduce the concept of gender identity to children before they develop this cognitive ability for sex constancy is so unethical, because you are going to deliberately confuse children before they even have the cognitive capability to understand the immutability of biological sex.
Puberty blockers, they stop normal reproductive system development, including the size and function of genitalia, and the capacity to produce sperm and eggs. So puberty blockers halt that normal developmental process. We do not know if puberty blockers, when used to block normally timed puberty, are reversible. And we also do not know long-term if fertility will be preserved, even if only puberty blockers are the hormonal intervention.
Hormone blockers are not licensed for this purpose. They were licensed for precocious puberty and would have been given for a very short period of time to a younger child.
Because the drugs stop sex hormones, they're also used to treat some reproductive problems in women. Interesting that women can only allow to take them for up to 6 months because they have such serious consequences. And they're also used to treat prostate cancer in men. And in fact, GnRHA was first developed to treat prostate cancer. So one of the licensed use should be mentioned, and that is the treatment of what is called severe sexual deviation in men. But plainly, they're used to chemically castrate sex offenders. A recent review actually warned that they should be used only for the worst sex offenders because they have, to quote, extensive side effects. It does seem a bit odd to give the same drugs to children suffering from gender dysphoria as are used to chemically castrate sex offenders.
As a psychotherapist, I believe that if a child comes to you and says they have a belief and they feel this way about their body, as soon as you say, yes, I think you're right, and this is what we're going to do for you, I think you have irreversibly altered that child's psychology. The sex hormones that we're usually subjected to in adolescence really encourage our brains to develop. That's why teenagers are so up and down. That's why they're so moody. They're going through all sorts of psychological development to prepare them for adult life. If you give a 10 or 11-year-old a hormone blocker, they won't go through that.
We're also seeing many, many stories of teenagers, mostly teenage girls, who are identifying as trans, who would fall under being diagnosed under the current DSM criteria. They are dysphoric for more than 6 months, often up to years, even in their tweens and teens. And then they are completely outgrowing gender dysphoria. So they are going to look like an official case to a therapist and a doctor who are now giving them hormone blockers and testosterone.
It's frightening to even think about because the gender identity theory trumps all other possible explanations for why a child who's female might be behaving in a masculine way. And what's the problem with her body is her body itself. We see a push from these clinicians and physicians to advocate for younger and younger and younger intervention. One of the leading gender identity physicians who has a $5.7 million grant to study intervention in children, she's talking about the pushback she typically gets from providers and parents about medicalizing children. And she explains that the more she educates people about gender and about gender identity, the less hesitant professionals are to administer medical interventions on children. There's a video where this same physician is describing a metaphor about Pop-Tarts. So she describes that an 8-year-old female came into her gender clinic with her mother, and this girl had very short hair, was dressed in a boyish appearance, but this girl was actually insisting that she's female, and she was arguing with her mother about whether or not she's been questioning her sex from a young age. So the mother brought this child to this doctor to help her kind of clarify things. And the doctor says, I asked the child, do you think you're a boy or a girl? And the child says, I'm a girl because I have this girl body. And the doctor goes on to say, well, have you ever had Pop-Tarts? And the kid says yes. And she says, well, what happens if you open a box of Pop-Tarts that say cinnamon Pop-Tarts on the outside and you unwrap it, but it's pink and it's a strawberry Pop-Tart? Is that a cinnamon Pop-Tart or is it still a strawberry Pop-Tart? And the kid says, it's still a strawberry Pop-Tart. I guess I'm really a boy, but this girl body is covering me up. There's another activist clinician who's giving a talk about gender identity, and she's describing pre-verbal gender messages in babies.
I have a colleague who's transgender, and there is a video of him as a toddler. So he was assigned female at birth. There's a video of him as a toddler tearing barrettes out of then her hair and throwing them on the ground and sobbing. That's a gender message. There was one, I think this was in the Barbara Walters special, where this child wore the little onesies with snap-ups in between the legs, and at age 1 would unsnap them to make a dress and have the dress flow. This was a child who was assigned male. That's a communication, a pre-verbal communication about gender. And the message back should not be to negate any of those expressions, but to go with them.
Medicine's moral core, which is to do no harm, don't do anything that we know harms people or might harm people, be very careful with what you do, gets pushed away as a kind of, you can't tell us what to do. So it's very odd to me, that one day I can get a referral to my service. I run a psychotherapy service for people with long-term complex problems. I get someone referred to me by a plastic surgeon. And this is a young woman who had said there was something wrong with her nose. She was a woman in her 20s, and she wanted the plastic surgeon to operate on her nose. And he saw her a number of occasions. And he said, really, I cannot see it. I do not think there's something wrong with you. I do think there's something wrong in the way you talk about this, about your relation to your nose. She came to us, to my service. It turned out she had a lot of very serious problems in childhood. But after a year and a half, she understood that her nose was exactly the same as her father's nose. It seems odd to me that no one's saying we have to affirm straight away this person's abnormal nose and operate on it. And yet in clinics all over the world, someone presents and says, I want to get rid of my penis, or I want my vagina removed and replaced with a fake penis that can never be a penis. And we have to affirm it.
The current narrative that's being promoted by LGBT organizations is that transition underage is a human right. So there are children who know who they are in this narrative and that they have the right to proceed in their personal path and what they desire. These gender clinics are dealing with youth who may just wind up getting hormones on the black market. So it is a very strong drive. I do acknowledge the ethics dilemma that they are in. But if you take mostly borderline dysphoric LGB youth and some probably autistic heterosexual youth as well, or trauma victims or things like that, and you permanently medically alter them, that's not just difficulty in puberty you're dealing with or difficulty for a few years. You are talking altering them for the next 60 years of their life. That is also a human rights issue.
There is a message out there that trans youth are at very high risk of suicide. With some of us are looking at these suicide statistics, and we're finding that the risk of suicide is nowhere near what the media has presented.
You see, what the trans industry has done is has created the narrative that they're all on the verge of suicide, and the kids have internalized that. People like Diane Ehrensaft, when I surreptitiously filmed her at the Gender Spectrum Conference, she was telling an audience of so-called gender therapists how to coerce reluctant parents into putting their kids on puberty blockers. She says, you know, there's a lot of people who are infertile, as one would be after taking puberty blockers. These kids are not going to have kids. Now, a lot of people are infertile, but you know what? They're not suicidal. On the other hand, people who are denied their gender identity, they are suicidal.
In these online communities where it's being fed that if you're trans if you think you might be, that's one thing. And if you're trans, you're going to be miserable and want to kill yourself unless you transition, you know, this narrative of suicide or die. They'll take an impulse that might have been fleeting and they'll feed it. There's no question that if you're spending time in pro-suicide communities online, your chances of actually committing suicide greatly increase. You can kind of become suicidal because people have told you that you're suicidal. You can come to believe that about yourself and really experience it as real. That's how we are as humans, is that what we believe about ourselves becomes effectively our emotional reality.
These young people, a large number of them, have other problems. So how can you say the suicidal ideation is only due to the gender issue? Could it not be that the gender issue sometimes and the suicidal ideation are both phenomena that have another common cause? For example, being gay. Children, even in our so-called liberal culture, particularly if they come, you know, not from a liberal urban center, but maybe from a village in the countryside, it isn't as easy as people think it is for young gay people. And, you know, being gay and feeling that you're strange and odd is likely to be associated with all sorts of thoughts, including suicidal ideation.
The main arguments in the Born This Way campaign for gay rights have been readapted for gender identity and for the notion of it being fixed and innate. Being attracted to someone of the same sex doesn't require you to make any modifications to your body or take drugs, as the activists say is like a necessary treatment for gender dysphoria.
conversion therapy refers to originally to someone who has a particular sexual orientation, and someone claiming that to have that sexual orientation is a pathology, and my outcome of treatment will be to change you, say from being a gay person to being a straight person. Homosexuality was in the diagnostic manual of psychiatric disorders as a pathology. Those who say that you have to act upon it, that is, you have to say Jane is John from one day to the next, and maybe a few weeks later start them on gender-blocking drugs, which start them on the pathway, because 100% of children who are pubertal, who go on gender-blocking drugs, go on to opposite-sex hormones, and no one knows how many of those go on to surgery. But that sets them on the pathway. Well, to me, that's conversion therapy. That's conversion. Because instead of thinking and stopping, you're acting upon the person to convert them in such a way to change their body to immediately fit in with their current view of their body. So that is conversion therapy.
The mental health field in particular has a terrible track record of dealing with homosexuality, and there is tremendous kind of institutional memory about that and guilt. And I think there's definitely a sense of we don't want to make the same mistake twice. I think the activists have also done a good job of equating these things, that, you know, transgender is like lesbian and gay, and even just tacking the T on to the LGBT acronym, when it really is a different thing.
So you've got a situation where now kids are being told to bring, young lesbians are being told to bring condoms on their dates for PIV sex, which is short for penis and vagina sex. And this is actually in an article. And the kids don't realize who this information's coming from. They just understand it to be the norm, that they can now expect as a lesbian to have to bring a condom on their date in case the lesbian that they're dating has a penis. So you've gone and changed the meaning of lesbian, so it's no longer even a definable thing. Somewhere along the line, people stopped understanding that, same-sex attraction, exclusive same-sex attraction isn't something you could change if you want to. You can't pray it away. You can't think it away. You can't, be explained out of it. It just is.
What happened when homosexuality was depathologized by the mental health community is it resulted in it being demedicalized. It used to be that some of the most abhorrent conversion therapy practices involved, these really inhumane medical treatments like chemical castration, just awful. So when we pathologized it, we also medicalized it. What the activists are looking for with affirmative therapy and wanting to depathologize transgenderism is they're actually looking to medicalize gender nonconformity. So if we simply said, listen, we're going to depathologize gender nonconformity, we're going to demedicalize it, people can present how they want, people can love whom they want, we don't need to worry about gender roles, it's okay to not fit, that would be great. But in fact, what we're doing is we're saying, okay, we're not going to pathologize it. We're saying it's totally normal. And at the same time, even though it's totally normal, we have to do these extreme medical procedures.
And that is a kind of perverse utilization of that history of conversion therapy and homosexuality to tyrannize therapists and clinicians who want to think, and to prevent them from being able to do so, and to convince the organizations that employ them that allowing them to think in this way is allowing them to be transphobic.
A lot of people, and just in the general public who haven't thought much about it, think, well, of course we should, be very accepting of trans people. It's the same thing as being lesbian or gay. And by the way, we should be accepting of trans people. That's not a question. The question is, to what extent do we normalize or rush medical transition for young people? That's really my concern.
The idea that I could actually live a happy life being solely attracted to women and being solely in relationships with women was something that was very difficult for me. I feel like that was heavily, heavily influenced by the way I grew up. I grew up in a very strict religious household. Women were considered to be mothers, caretakers, homemakers. It was considered a vile sin to go and get a job as a woman. You were meant to get married young and have children. That was never something I was super interested in. In this weird, sort of mostly subconscious way, I had internalized all these things from my parents where women do this, women do that. So I felt like, okay, I'm not supposed to be this way. I'm not supposed to be attracted to women. I'm not supposed to want a career. I'm supposed to want to be a homemaker. I'm supposed to want to be a man's wife. Why don't I want that? I must be broken.
When I was going through high school and started to realize I did like women, and I started to come home and I would have printed out Bible verses on the bed about homosexuality, and it would just make my heart hurt, because you knew that your family deep down knew, and were trying to persuade you against it and make you read the Bible and see why it's bad and why you shouldn't have it.
When it was first brought to me through my kid, I actually didn't know all of the medical stuff. I didn't know, and if it had just been a physical appearance thing and I'm just going to dress this way, like, I wouldn't have cared at all. It wouldn't have bothered me in any way.
Someone that's 18 struggling with who they are, we all struggle with our identity all the time. But a teenager who's struggling with their identity, and then we encourage them to go ahead and change who their bodies are and give them hormone replacements, that's the worst thing that anybody can do. She needed more therapy, not someone to just agree with her, oh yeah, that's what you need to do.
When the medical world focuses on affirming only, it sidelines all these other questions and actually makes it impossible to find other solutions other than physical transition, because you're not asking the right questions.
The centrality of guilt. That any child who suffers from has real mental suffering, parents who are reasonably in touch feel terrible, and they feel responsible. And they can't be completely non-responsible either. You can't say to parents, oh, no, it's nothing to do with you. But you can help families try to understand how things have got to this place. So parents who feel very guilty, I think sometimes, if the child said, if all the difficulties get reprogrammed through the prism of gender, so now everything is gender, it's not depression, it's not autism, it's not trauma in the past which the family may feel guilty about, it's gender, and that's a completely separate thing. That has a consequence of relieving the parents of guilt. So the parents may even join up and say, yes, we support you in being trans for unconscious reasons, not because they're bad people, but for reasons they themselves don't understand. But that is, again, the services don't question that. Then the parents who do question it and may have real concerns are othered. So these tyrannical organizations, which do not see themselves as tyrannical, are to some extent unwittingly exploiting the vulnerability of parents.
One of the things that's really hard is that these parents tend to be very isolated. They're often vilified. They're vilified in the media. They often are not helped by the very professionals that they assume they will get assistance from. So mom is like, wow, my kid is suffering. She has gender dysphoria. Let's take her to a gender therapist and get some specialized help on this. And then the first session, the gender therapist is saying, yep, if you're trans, if you say you are, and let's get this transition started. And mom's like, hold on. And the therapist is saying things like, you're either going to have a live son or a dead daughter, and you need to get your own therapy to deal with your transphobia or something like that. So parents feel really undermined by professionals in some cases. It's a really, really difficult situation to be a parent.
Child psychotherapy clinics, what they usually do, child psychiatry, is that a therapist sees the child and another therapist sees the parents. And the aim there, because we know you can do all the therapy you like with a child, but if they go home to a very distorted world, then it's not going to help. They need to be happen in conjunction.
A lot of parents will do just tons of research about the negative effects of cross-sex hormones or whatever, and then they want to deliver this to their child, and they'll often say to me, she's so smart, she's such a science kid, why can't she see this? And I'm like, please do not give your kid a whole packet of information on the negative effects of cross-sex hormones, because for one thing, that's just not actually how the human brain works. We know this, that you make emotional decisions and then you justify those decisions ex post facto with your rational faculties. We all do that. So your kid's already made up her mind. She's already deeply embedded in this belief system, and your facts are not going to change her mind. And she could go to the internet and she could pull up all kinds of information that talk about how great cross-sex hormones are and how they're totally safe and how people die without them because they kill themselves. So it's kind of a losing battle, and it will just create unneeded animosity. I think it's much better to just focus on staying connected, spending time together, spending enjoyable time together, listening to your kid, no matter what, listen. Parents of older kids, 17, 18, 19, have to be prepared that their kids might transition. It just might happen. And if they do transition, they're still going to need you. So you need to stay connected.
I think parents often forget that children can have almost a metaphorical back alley experience right there in the comfort of their own bedroom, because the cell phone exposes them to a vast array of very harmful materials. And kids sometimes are finding graphic and violent pornography as young as 8, 9, 10 years old. And if you are a young person who has no sense of your own body, sense of autonomy in who you are just a child, you do not understand sexual material, and you are exposed to really degrading, violent, and painful pornography scenes, that is going to have an impact on your sense of self. I'm very concerned that a lot of young children are having all kinds of exposure to adult contact from possibly from predators. Unfortunately, while parents think that they are protecting their kids by not letting them walk to the playground by themselves, they sometimes forget the type of danger that their kids can run into online.
As your internet angel, as your envy parent of the webs, let me tell you, you're doing great. People are calling me the internet mom more and more lately, and I like it. If you need a place to be and to be safe, you can do that here. My page is your family. This is a family. I know a lot of you have been stuck for months with a family that is not good, that is not respectful, that is dangerous even. You are safe here. I've learned to love myself so much, and I have love left over to give if you want some. I know that you are worthy. I know that you are deserving. No matter what they say, and if you've been rejected by everybody, You can be in my family. I want you over here.
As an OBGYN, really I find the assigned sex at birth being very inaccurate. Having been in the delivery room delivering babies, it was not an assignment. It was not gosh, I wonder what's going on. It was based on observing the child's anatomy and documenting that.
Some boys were born with micropenises or with hypospages in their penises, so where the urethra is on the underside. And sometimes the doctors would decide that the boy's penis was not adequate enough and he would never be able to grow to be a man. This is obviously not what I think. This is the reasoning behind it. What they would do then is remove the boy's penis and testicles and create a neovagina. And the boy would be told he was a girl and would be raised as a girl. That's what we mean when we talk about assigned sex, because it's not the baby's sex, or it's not their biological sex, but they have this sex assigned to them that they will live their life as. I think it's really unhelpful for other people to use that language. If that happened to you, you would want and need words that describe that unique thing. And applying that language to everyone else when the rest of us just had a simple observation of our genitals, I think is really cruel to those people who should be able to say that they were assigned, that this is what happened to them. There's no real definition for intersex. It's not a biological term. People think it means that we're in between the sex or a mixture of the two sexes. That's not really true. It just means we have a reproductive tract or reproductive organs that aren't typical for what you would expect for someone of our sex. So in my case, I'm female, but I don't have all the female reproductive organs you would expect. I don't have a cervix. My uterus isn't developed properly. DSDs it's an umbrella term for about 40 plus medical conditions that affect the development of the reproductive tract. So genitals, internal reproductive organs, hormones, growth, and sex chromosomes, that kind of thing. There's an estimation, and it's the global population rather than individual countries, that about 1.7% of the population you'll hear. It's slightly misleading. In the 1.7%, there is one condition, which is a condition that happens later in life, and that accounts for 1.5% of that 1.7%. So actually people that are born different, it's about 0.2% of the population. It's really unhelpful to have it as an identity, because obviously then you could have people who don't have DSDs identifying as intersex, which does happen. It's not as uncommon as you might think. No, it's not an identity, but it is a label in theory that is a choice to be used, but it should only be used by people who have DSDs. Transgender people often feel that if they were intersex, if they did have a DSD, it would explain how they feel. So I think a lot of trans people think that at some point. They have this idea about intersex brains. So they think that they have the brain of the opposite sex. Because of this misconception of intersex meaning a mixture of the two, that must mean that being trans is somehow another form of intersex, which it isn't, because your brain isn't your reproductive tract. We are people who are not typical, but that doesn't mean that you could sort of line us up in between male and female and get like a continuum of anatomy or whatever between the two.
In addition to research on the process of transition, if I also had the resource of a knowledgeable therapist or psychiatrist who was equipped to deal with PTSD and history of sexual abuse and things like that, that maybe I would not have made this choice.
I basically Googled everybody that does gender transitions close by. Because you have to go to therapy before you are able to medically transition. You have to go to therapy for months, or so you're supposed to. And so I researched basically any therapist that would do that or had that in their title. So I found one that lived in the same city as me, and I made appointments to start going. And I told the woman that I wanted to start hormones on my birthday, basically going in, stating my diagnosis, telling them what I wanted, and seeing if she would do it. And she said, absolutely, I can definitely help you. I can write your letter for your hormones, and we can try to get this done by your birthday, which at the time was 6 weeks away. So I had 6 1-hour appointments, maybe even 5. I might have missed a week. 1-hour appointments for this woman to write me a letter to change my life forever.
Let's say a 16-year-old comes to my office and she says, I'm really a boy and I want to transition and I want you to write me a letter. And I said, well, let's talk about it first. And she says, okay. So we start exploring. There is no way that I can say, I've talked to you now for 12 sessions and I really think you're not trans. There's no basis for me to make that kind of statement, because it is her subjective reality that is true for her. There are no biomarkers. In other words, we can't do a brain scan, we can't do a blood test. It is a purely subjective experience. And so it's unfalsifiable.
Were you in a bad situation growing up? Were you sexually abused? Were you physically abused? Were you mentally abused? And those are red flags. And I even said some red flags to the therapist, and nothing, just smooth sailing. We moved right on past that.
I was only in therapy for a little over a month before I got my letter of evaluation. Now, at the time, I believe we had to live in our desired sex, if you were transgender identifying, for 6 months before getting a letter of evaluation saying you could have cross-sex hormones. So I was given cross-sex hormones way sooner than legally was required. And it was, in fact, misrepresented in my letter that I had been in therapy for a lot longer than I actually was. Pushing a person like myself in that direction and encouraging that person to take medical steps towards transition, I think was a very dangerous thing. I was not told about much of the long-term effects from my therapist.
Once it was time, she gave me my letter and everything, referred me to a doctor that she knew that could do it. The doctor comes in, doesn't even visit with you, is kind of very rude, and asks you if you have your letter. You give him your letter, and that's supposed to say everything, like why you should be diagnosed, if it's right for you. He never even opens the letter and tells me, are you sure this is what you want to do? And at the time I was thinking yes, and I told him I'm a little nervous, and he said, well, do you not want to do this? And I said, well, I'm just a little nervous about everything. And he was like, well, I need to know. And then I asked him if he would be giving me my first shot, because I asked him when I would start, and he was like, you can start today. I was like, oh, are you going to give it to me? And he said, not unless you want to drive all the way back to your town and drive back, when he had a pharmacy upstairs that he could have called it in and taught me how to give myself my shot the first time. But he didn't do that. He told me that I could go home and figure it out and watch YouTube videos, and that I couldn't kill myself trying.
Females who take puberty blockers and then cross-sex hormones will experience menopausal symptoms, possibly uterine pain, and testosterone within a very short period of time, usually months, will cause irreversible masculinizing changes, including body hair growth, loss of scalp hair, deepening of the voice, and clitoral enlargement.
After my voice started changing, like I said, about 6 months in, I started having a lot of hair loss. It was actually very scary. I'd be in the shower and clumps of my hair would come out. My doctor felt like I was not seeing changes happen regularly. So she suggested I increase my dosage quite a bit. However, I was not prepared or told even that kidney and liver damage could be related to cross-sex hormones. I had jaundice all over my body from the liver and kidney issues. I could not regularly expel waste. I was consistently bleeding. I was consistently vomiting.
Women who take testosterone have approximately 4 to 5 times the odds of developing heart disease versus normal. And this risk appears to be elevated not only versus compared with women, other women, but also men. So there's a misconception that women who take testosterone will have the same risk of heart disease as men, but that's incorrect. It's actually higher.
According to the WPATH, the World Professional Organization for Transgender Health Guidelines, I think it says they should be on the hormones for a year before any surgery. It has become more common, and I think Dr. Joanna Olson-Kennedy kind of led the charge to lower the age. And in fact, in her 2018 paper, she said, don't even give them testosterone. They have chest dysphoria, where they feel like a man, but they have their breast growing in, and they're growing a beard, but they still have their breasts. So don't even bother with the testosterone. Get them on the surgery first if that's what they want, and then give them the testosterone. So the effect of that would be that these girls would have no time to reconsider what's happening.
Infertility is very likely, and sterility is, of course, certain if the testes and ovaries and uterus are subsequently removed.
And there is also a question on the effect on full adult sexual function, whether full sexual function, in other words, orgasm, is achievable at all. And in any case, with this treatment, a normal sex life is not achievable with a medically constructed vagina or a medically constructed penis, which is insensate. It doesn't work as a penis.
Dr. Carl Hennigan, who is the editor-in-chief of the British Medical Journal Evidence-Based Medicine Division, and also Dr. Christopher Gilberg. He's a renowned autism expert. Both have remarked that the administration of puberty blockers and cross-sex hormones to children and adolescents essentially represents an unregulated live experiment on children. This might be the greatest medical scandal of modern medical times.
Initially, I felt what a lot of people refer to as gender euphoria, which it's kind of an argued term. However, it basically means that once you begin presenting as your desired sex, you get this feeling of euphoria where it's like everything is right in the world suddenly. I had that for a very, very short time. I want to say maybe a few weeks. I actually found that dysphoria increased dramatically in me with the changes. I started growing hair, and my voice started changing very rapidly. So as those changes came on, I became exceptionally suicidal. My discomfort with my body was increased by 100. I would look in the mirror and I would just burst into tears. I couldn't see myself anymore. I couldn't hear my voice anymore. And it made it really difficult to continue. And I addressed this consistently with my gender therapist, and she persisted that this was normal and this was good and healthy, and I would get through it, and I just had to push forward.